I am presenting my oral defense over the correlation of stress, isolation, and depression in Alzheimer's disease caregivers. So, what is Alzheimer's disease? It is a type of dementia that causes a person's brain cells to die. Symptoms of the disease include memory loss, confusion, disorientation, delusions, aphasia, which is difficulty swallowing, and much more. There are only treatments and medications that can slow down the progression of the disease, but there is no known cure. There are 7 stages of Alzheimer's disease, which can be classified further into early, middle, and late stage Alzheimer's disease. People who are going through the middle stages of the Alzheimer's disease will start to require full-time caregivers. The problem is that people with Alzheimer's disease are experiencing abuse or neglect from their family caregivers. The act of abuse is an intentional cause that harms a person, including physical, emotional, sexual, and financial abuse. The act of neglect is a type of abuse that can be intentional or unintentional, in which the caregiver does not provide the elder with the necessary daily care and hygiene. This is a problem because older adults with cognitive decline are vulnerable, which makes them incapable of protecting themselves. What is already being done? In the state of Arkansas, a mandated reporter should report suspected elder abuse when they have reasonable cause to believe that an elder is suffering from abuse or neglect. They are trained and required by law to report any suspicion of abuse or neglect. In many situations, family caregivers, such as spouses, children, or siblings, feel obligated in taking care of their family members that are suffering of a long-term illness. Family members should not take on the responsibility of a full-time caregiver because they get burned out and become neglectful without even noticing it. They need to learn to notice when or what they are doing wrong when providing care. When a family caregiver takes on the responsibility of a full-time caregiver, they are more than likely not getting paid, and they have limited time for themselves, which can cause an increase in depression and stress. Our key words are Alzheimer's disease, stress, depression, isolation, caregiver, elder abuse, elder neglect, and burden. Family caregivers, however, are an unrepresented population that have been identified as a group of great risk for physical, emotional health consequences because of the stress of caring for a loved one. The baby boomer generation is aging. With this generation aging, an influx of caregiving positions and elders are needed. The specific aims of this study were to examine the relationships of 3 aspects of leisure, which are leisure preparation, satisfaction with time of leisure, and satisfaction with the quality of leisure experience, and perceived stress with self-reported health. It also tested whether perceived stress mediated the relationship of these leisure constructed with the self-reported health of family caregivers. The results of the study concluded the importance of leisure as a way to reduce stress and improve health of family caregivers. Research demonstrated that symptoms of depression and anxiety are a common finding in caregivers of those with dementia. The study's purpose was to examine the differences in burden and psychological distress in Alzheimer's disease caregivers, how functional abilities in individuals with Alzheimer's disease account for the burden and psychological distress experienced by the caregivers, and how well patient neurophysiological functioning would predict aspects of caregiver experiences and psychological well being. Alzheimer's disease caregivers report feelings of missing out on life and activities because of the responsibility of caring for their loved one. If the caregiver feels unable to escape the situation, he or she may become abusive. The purpose of this study was to determine if stress makes the caretaker abusive or neglectful. The results of the study found that spouses are the most frequent abusers. The abusers are more likely to be arrested, hospitalized for a psychiatric condition, involved in other violent behavior, or limited by some health problem. The abusers were also described as substantially more dependent on the elderly they victimized. So, our rationale. The purpose of this study is to show that caregivers that are stressed, depressed, or isolated can result in elder abuse. We predict that stressed caregivers will report that they are more likely to be involved with elder abuse than depressed caregivers as a result of increased burden. Our null hypothesis is that stress, depression, and isolation can lead to elder abuse. Our alternative hypothesis is that family caregivers are exposed to high level of stress. Our demographic variables are age, gender, classification, ethnicity, marital status, hometown, and socioeconomic status. Age is defined as the number of chronological years since birth. Gender is defined as either male or female. Classification is defined in terms of the stage of Alzheimer's disease. Ethnicity is defined as a group of people who share cultural characteristics. Marital status is defined as either single, married, divorced, or widowed. Hometown is defined as a town where one grew up in. Socioeconomic status is defined as a person's economic and social status in comparison to others. Our main variables are stress, depression, isolation, elder abuse, and Alzheimer's disease. Stress is defined as excessive workload that can make one feel overwhelmed, tired, irritated, which leads to other mental or physical illnesses. Depression is defined as constantly feeling tired, loss of interest in activities, and suicidal thoughts. Isolation is defined as not being able to participate in regular developmental or social activities. Elder abuse is defined as emotionally or physically harming a person who is in the care of someone. Alzheimer's disease is defined as a type of dementia that negatively affects the person's cognitive, orientation, and memory. The purpose of this study is to correlate how the mental status of the caregiver can affect the elders with Alzheimer's disease. We hypothesize that two or more behaviors, stress, depression, and isolation, will be related to elder abuse. We intend to recruit 20 participants from the Alzheimer's Association Arkansas chapter. It is our expectation to recruit an equal number across gender, ranging in age from 65 to 75 years old, with diversity across ethnic groups. We further anticipate recruiting participants in stages 3 to 5 of Alzheimer's disease. We will set up a table in both offices of the Arkansas chapter of Alzheimer's Association, which are located in Little Rock and Rogers. We will have them fill out a questionnaire on the spot. To recruit my participants, I will say, "Hi, my name is Barbara Mendez, and I am conducting a study to determine if the care of a person with Alzheimer's disease can cause mental and economic issues. It's an assignment in my research methods class. We are recruiting 20 participants in the Alzheimer's Association in Arkansas. We would appreciate about 5 minutes of your time to participate." We will contact Kristen Dickens, the Executive Director of Alzheimer's Association, Arkansas chapter, for permission to recruit participants from their organization. I will mention who I am, the purpose of our study, why we want to recruit her organization, and the benefits of participating. Alzheimer's patients and family caregivers will sign consent forms. It only requires 5 minutes to complete the questionnaires, and there are no known serious risks related to participation in the study. The lead investigator is Dr. Rita Barrett, and the student researcher is me, Barbara Mendez. There will not be any reward for participating in the study, but confidentiality will be taken to protect the identity of all participants. When completing the demographic variables, I will be asking my participant to identify their gender, age, classification, ethnicity, marital status, hometown, and socioeconomic status. The first questionnaire will be asking the caregiver about their mental health from 10 years ago. This Likert scale has 5 options ranging from 1 excellent to 5 terrible. The questions asked are: how would you rate the level of stress you were in? How would you rate the level of depression you were in? How would you rate your financial status? How would you rate your social life? How would you rate your overall health? How would you rate your overall lifestyle? How would you rate your overall happiness? How would you rate your relationship with your family? And these questions are all related to 10 years ago. So if the participant score ranges from 1 to 8, this means that 10 years ago, the caregiver was not experiencing any type of mental health issues or economic hardships. If it ranges from 9 to 16, it means that 10 years ago, the caregiver was expressing a slight amount of mental health issues or economic hardships. If it ranges from 17 to 24, this means 10 years ago, the caregiver was experiencing an average amount of mental health issues or economic hardships. If it ranges from 25 to 32, this means 10 years ago, the caregiver was experiencing more than average amount of mental health issues or economic hardships. If it ranges from 33 to 40, this means 10 years ago the caregiver was experiencing a terrible amount of mental health issues or economic hardships. The second questionnaire will be asking the caregiver about their mental health now. This Likert scale has 5 options ranging from 1, excellent, to 5, terrible. The questions asked are: how would you rate the level of stress you are in now? How would you rate the level of depression you are in now? How would you rate your current financial status? How would you rate your current social life? How would you rate your current overall health? How would you rate your current overall lifestyle? How would you rate your current overall happiness? How would you rate your current relationship with your family? If the participant's score ranges from 1 to 8, this means the caregiver is not currently expressing any type of mental health issue or economic hardship. If it ranges from 9 to 16, this means the caregiver is currently expressing a slight amount of mental health issues or economic hardships. If it ranges from 17 to 24, this means the caregiver is currently expressing an average amount of mental health issues or economic hardships. If it ranges from 25 to 32, this means the caregiver is currently expressing more than average amount of mental health issues or economic hardships. If it ranges from 33 to 40, this means the caregiver is currently expressing a terrible amount of health issues or economic hardships. Our expected outcome is that compared to 10 years from now, the family caregivers have experienced a greater amount of mental health issues and economic hardships. And lastly, here are all of our references.